And I asked Chief about the MOU.
Uh-huh.
He just replied back, as was the email, he wasn't. Chief.
This is really the third meeting we've done on live stream.
Yeah.
That's like,
Yeah, so it's linked, so they automatically be posted to the YouTube page, like within like 30 minutes after.
where do you watch them from?
You can watch them from YouTube, but I embedded the YouTube onto our website. So if you go like.
Yeah, I went in, I was trying to bring it up in the conference.
Okay,
So Captain Winglish is in support of the MOU. He has done it to the executive session.
that's good.
As soon as they vote on this.
Is it okay?
You can put council meetings from like the main page.
Yeah.
And then you can either view meetings live, make a public comment, which takes you to
Yep.
YouTube, and then view past meeting. It takes you to YouTube.
You need that updated in email.
Yeah, shoot me an email. Yeah,
Great.
that'd be great, because Bob was one thing Bob was concerned about.
Chief didn't know if they would be able to-
Hey, Bonnie. Good, how are you doing? Yeah, I wanted to talk to you about something real quick, since you're here. Come on back. Oh, sorry.
Oh, I get to go in the back.
Oh, no, you're fine.
Am I in trouble?
No, not at all.
Oh, you can get that in.
Or 3 out of 4. You should have won all 3. But they've traded so right. Have the go. Yeah, it's not baby.
That little babies are.
He wants to know. But he came home and
They're.
Just can't.
They got a long way to go. Thank you for your. I thought, I didn't.
You always have your. I learned that in a hard way.
Yeah.
I'm your team. How are you doing today, sir?
Sorry, big sense.
That's okay. That's good. Well, let's see, we know what they said, but, yeah, it's great, man. He's heading to Europe to go on a so yeah, he called me from the ferry. He was on the ferry to Jersey to go to Newark. It's the.
Now, do you mind if I stand?
Absolutely.
Absolutely, you're
And,
good to go, and I offered your team if we get it full, they want to sit in here. That's fine. You might have to vote on things.
Sounds fine.
We don't vote. It's like school. You guys got quiet.
There's a couple seats up front too.
It is 12 o'clock.
There are several seats up front if anybody wants those.
Please come in and have a seat. We want to be as informal as possible. So we can talk a little bit about what we're trying to do. What we're proposing. So if you're ready, I'm ready. You ready?
Right.
Obviously, I'm not in a position to, go to each of you and say, who are you? And where do you live? But at this point, here's what we're gonna do. We're gonna talk a little bit about what. Absolutely. Is it?
You can pick it up.
Are we video streaming?
We are live stream.
There may be some comment from online.
And the camera doesn't move, right?
No, but it covers table to table.
Okay. When I was in the Navy, and I was a commanding officer in San Diego, boy, I don't know if I should say this because we're streaming. Would you believe, I had the Naval Medical Center San Diego, which if you were in the Navy, is a large military base. I had a crew of almost 5,000 people. It had a school, it had a hospital, of course, it had a fire department, and I was the commanding officer of the base. And so we had a lot of dignitaries. And of course, when that happened, every time I went out there and had to go up there in my white uniform, I had this one corpsman who was the master chief. And anybody know what a master chief is? Command master chief, right? Senior enlisted.
Oh, no.
Right? Who in the Air Force, what is that? Is a command tech master sergeant? Chief master sergeant, who assigned this guy to follow me around. So one day I'm like, Corpsman, petty officer, why are you following me around? And he said, well, sir, I've been assigned by the command master chief to make sure that your fly is fully zipped when you go in front of TV. Right? I assume you're enlisted. You serve, sir? So that is in many ways that they really made sure to take care of me. That's where I learned a little bit about servant leadership and how to make sure that we took care of them. So when I heard that, I don't know if you saw, but when I heard that there was a camera and you guys are video streaming, I kind of looked down real quick, but I think we're okay. I think we're okay. So on that note, how are you? I'm David Tam. I'm the president and CEO of Beebe Healthcare. I've been there for 5 years. This is today, for those of you who are on, and by the way, is this being recorded as well? So today is the 31st of July, the last day of July, and we are right here in the Millsboro City Hall because we wanted to make sure and have an open community dialogue with you all about what we are planning to do at the Beebe Healthcare Millsboro Health Center. You might want to know why the name is like that and what is that all about. So we will talk a little bit for about 10-15 minutes about sort of the concept of why we're doing what we're doing. And then, of course, I'm just going to open it up and do my very best Phil Donahue imitation. And if the camera follows, great, but I'd like to make sure that I hear the question from you. So I might come up to you. And if you're comfortable, tell me your name so that I don't just say, hey, you, and let me know your question. I do have some staff members with me. I have Diane Taylor, who's my chief of staff and chief strategy officer. I have Paul Magliotto, who I joke around as the director of facilities and construction, that he is the most expensive person on my payroll. right? If you think about all the things that he's built, but he's done a lot of the buildings. If you saw the Long Neck facility that we just built, he was in charge of putting that together on time, on budget. And if you've been inside, it is just absolutely gorgeous. And just as an aside, that building now, in about a year, when it's fully set up, I mean, it's already working. But when we have the full staff in there, is going to provide 30,000 more visits. So not moving from other places, but 30,000 new visits to the people of Long Neck. And that's important for you, right? Because some of you are in that part of Millsboro. Well, it may also be on the other end of Rehoboth and so on. So you got Diane and Paul. Anybody else that oh. And we also have with us someone who you know actually, who's presented to you before. We have one of our board members, Dr. Bonnie Hall, who's here. She represents, the board, but also you need to know that one of the things that that we did 5 years ago when I first got here from California, we made sure that the board and the organization reflect more the community that we serve. In many ways, for many years, I understand, Beebe was considered that place over there on the east at the tippy end of Savannah Road, and what a pain in the butt it is to go there. And that's a different crowd, right? So actually the board and the organization went through a significant reorganization and continues to do that. And Dr. Hall is one of the board members that helps represent your community to Beebe Healthcare. And let me tell you, she does a really good job, both as a person of color, as a member of the Nanaco tribe, and as a community member here in Millsboro to be able to share that information. So I'm glad that she's here. And then we also have Steve Tyson back there, who is from our foundation, because one of the things that I've been very good and learning how to do is know that we can't do it alone ourselves. And so we will be, of course, saying, if you want to help us out with some of the things that we're trying to do to serve the community, then he's the guy that you can talk to. I'll start with that. Healthcare is always a challenge, but I'm looking around the room at, I would say, my contemporaries in terms of our age range. Medicare and Medicaid are going to take a significant hit this year. Beebe Healthcare has already looked at some of the preliminary financials after having gone through the 1,000-page bill, now law, and we know that we will be looking at reimbursement issues because many people who had Medicaid will no longer have that. I'm not going to get into the politics of was it the right thing or the wrong thing? Is it good? Is it bad? But the reality is, when you open up an emergency room or a hospital, we do not do a wallet biopsy. We do not say, hey, you're bleeding really bad, or you had a heart attack, but I'm sorry, you don't have insurance, so go next door. We take care of all comers. And as one of the things I want to be upfront and share with you is that we are looking very hard at what the potential financial impact is of opening an emergency room here in Millsboro. I want to be bottom line up front in case you were wondering. We're moving forward. Okay? We're going to figure things out together as a community and recognize that need is there. I can tell you the need is there because as I was driving from my Lewis office and coming down 24 and Mount Holly, I passed, I didn't know you guys had 3 Millsboro ambulances, but 3 Millsboro ambulances passed me going east. We can't do that. And when I got here 5 years ago, I knew that we had to get to the point where we serve the community because, people with strokes, heart attacks, other kinds of health conditions that require more immediate care cannot wait, especially in the summer months when Route 24, it'll take about an hour to get down 24 and then 1 and then Savannah. Okay. Even if you went, I still remember someone showing me and teaching me how to go through Mount Holly and then the back roads. And even the back roads are now, I think, taking a lot of time. So I wanted to say that up front because we at Beebe Healthcare 3 years ago committed to opening up an emergency room and walk-in center, medical offices to serve the people of Millsboro. We invested a significant amount of money in buying that land at Plantation Lakes. We worked with DelDOT to make sure that the bypass did occur in that area, partly because we knew how important it was for ambulance drivers, EMS, first responders, right? And even families to be able to access healthcare without having to risk crossing DuPont or getting through Route 24 and up, the 113. So we made that commitment. And we waited for DelDOT to finish doing the bypass because you can't do two kinds of construction at the same time, right? But now DelDOT is almost done. You've seen it, right? They're finishing up Sheep Pen Road, which is really instrumental, and you'll see it as to why we've had to wait a little bit to think about not just when to start, but what kind of things we want to build. Because you'll see, I think on the site plan, where Sheep Pen Road really has an impact on what we want to do. So as you go through the rest of today, think a little bit about the questions that you're asking. I know that the mayor has already sent me stuff because he's in Europe somewhere and he sent me his greetings to all of you, but he already had a list of things that he wanted to make sure that was on our mind. And I have a feeling that they'll also be on your mind about making sure that it is not just Plantation Lakes, but almost all of Millsboro that we serve. Okay? The last thing I'll say before we start talking about it is we're going to go. We're not going to dither around and wait for years. We waited for 2 years because we could not have a good understanding of what DelDOT was going to do with Sheep Pen Road. And those of you who live in the area, you know that, right? There used to be, what is it, a BP gas station?
Yeah.
Right? It was my landmark. Coming from California, I knew that, okay, if I got to the BP gas station, I had to turn right to go down Hardscrabble. And then there's Sheep Pen. So when they took it away, I was like, where the heck am I going? But you can understand a little bit about how important it is for us to get a sense of the landscape before we really commit to what else we're going to build besides the ER and the other things. We want to partner with you to hear your thoughts about what we want to do. We know one thing. The other stuff that we build there, and it doesn't have to be just healthcare, but it should be something that we feel is critical to the healthiness of the community, to the wellness of the community. Beebe Healthcare is not just a hospital, but a health system that focuses on making life better, making people healthier for the people of Sussex County. So, there've been a lot of great ideas, and I want you to know that we will take all those concepts in mind as we think about it. And please believe me when I tell you that the other thing that we think of more than anything else today is how do we do that? So at the same time, not that we are a for-profit entity, but how do we make enough money so that we know we will lose money with the emergency room because we don't turn anybody away? And that's just the nature of healthcare ever since I started when I graduated from medical school. But it's harder today than ever before, maybe as an administrator. And so please know that those are the pieces that I think about, that we think about moving forward. Okay? Did I talk too much? All right. So what should we do? Is there a slide? Okay. Let's change slides.
There are seats up front if anybody wants to come.
Please come in if you want. Oh, okay, not him. Not George. No, come on in, George. Thank you, George. So, you probably already know this location, right? The site. By the way, Beebe has been here in Millsboro for a while. We have the building on Mitchell Street, right? As I call it, close to the Dunkin' Donuts building, right? And we also actually have a couple other clinics in different parts of Millsboro. But one of the challenges of having different places in different areas is the fact that you can't develop something that has a greater economy of scale. Support staff, who have a hard time finding a place to live, right? Even though we actually pay them just as well as anybody else in the area, right? Housing is more expensive, so you want to consolidate the need for support staff, for parking, for infrastructure, for medical records, all that. So that's why we are moving to, we decided that the best thing for us to do is go to Millsboro and take that site at the corner of 113 and 20. And by the way, I can't think of a better location for an emergency room. I really can't. If you think about the ability to get someplace from east, west, north, and south, and get to a location where you don't have to worry about traffic, it'll be good for the ambulances, it'll be good for paramedics and firefighters, it'll be good for police officers, and it'll be good for all of you. One of the things that you need to think about, next slide, is that as you go to this parcel that we purchased, there's an opportunity for us to really think about some of the things that you already know, which is how do we do a better job of connecting healthcare and potentially other services with Plantation Lakes, as well as with the rest of the community. So to be able to drive in, as well as to walk in. Can I ask how many of you live in Plantation Lakes? Okay, and thank you. I think it's beautiful. I like it. I don't live there, but I like it. I know many of our staff do. But be able to maybe have an ability to ride your bike or to walk in a safe manner into a campus, and I'm calling it a campus, right, is an important element for what we're trying to build out. You can see there that this circular area right here, this area right here, is where the Del Dot piece is. Thank you. Is where the Del Dot piece is going, right? So you can see there's 113, and then our property, the Beebe parcel, is in yellow, the dotted line where you see on the east side. It's kind of, I call it the pancreas, but you can call it whatever you want. It's that area right there, and we own that, and it is contiguous to the golf course and even some of the homes on that end of Plantation Lakes. And then you see the other street. The main issue is you see Sheep Pen Road, which I don't know if that's the new Sheep Pen Road or is it the old Sheep Pen Road? That's the new one, right? So even up until when that was built and, they started to lay down the concrete or whatever, we didn't know about what degree that would be. And that's partly because there was consideration and discussion with Del Dot about how much of a quote speed lane or an exit lane you need for people coming off or coming on that circle. Because if you got too close to it and have an intersection, then it's going to be dangerous. There's going to be accidents. Hi, come on in.
Could see the slides and didn't want to miss out.
Okay, well, now you have a front row seat at the slides. But you need to know that that space on the western part of Sheep Pen Road, that's also Beebe property. So that Beebe property is that yellow area, but it's also that green area without yellow dots. And that's really important because if you think about it, the only part of the property that is contiguous or accessible to a street is really that western part, isn't it? We don't have access to DuPont right here because the bypass goes that way. Those are some of the considerations that we are thinking about the parcel. And as you go to the next slide, please, you can see how we've tried to figure out how best to place an emergency room. And by the way, it's not just an emergency room. It's going to have medical offices. It's also going to have pediatrics. And I spoke with my compatriots at Nemours. Nemours, actually, I don't know if you know this, but Nemours actually is 2 hospitals health system. One in the headquarters is in Florida, and of course, there's the other one in Wilmington, right? So I spoke to the CEO, Dr. Larry Moss, down in Florida, and they're still with us. That committed to building out the pediatric ER with the Beebe ER. Now, whether it's two separate buildings or two separate locations, we'll figure it out. But it will have pediatricians from Nemours, as well as pediatric nursing. The facility will be built out in a different way so that there will be more of an interest. I'm a pediatrician myself, so you gotta have different furniture. You gotta have a different feel for kids, Does it mean that our ER docs are not good enough? Absolutely not. But I have a feeling, all of you who live in Plantation Lakes, every time I drive through now, I see U-Hauls with bikes and more kids running around, right? Schools being built. So we want to make sure that there is the ability to take care of kids as well. You can also imagine that in the summer, especially when there are so many people bringing their grandkids in, and other children are coming in for their family, that it would be good to have the ability to have a pediatric ER. So if you look at this page, a slide, you will see that the orange footprint is the building footprint, but it is not just an ER. It is also a pediatric ER. It is also an urgent care walk-in. I don't know if you know this, but in the state of Delaware, there is no designation for urgent care, even though I'm assuming there are people from other parts of the country like New Jersey or Maryland or Pennsylvania. So they have urgent care, which means that actually you call yourself an urgent care and you actually get reimbursed at a higher rate. Here in Delaware, we don't have that licensure yet. So we open an urgent care to make sure that it's open, 15 hours a day, no appointments, staffed. But when you come in, your insurance company pays us for a regular walk-in visit, like a primary care visit. So you can imagine how hard it is. It's like having a world-class restaurant with no reservations and staffing it with world-class people, knowing that, okay, it could be really busy and we get paid, or it could be really quiet when we have an empty restaurant, but we can't close. But we're going to have a walk-in there with our emergency room. And of course, the other part is medical offices. That's going to be on the second, third floors, right? And that's going to be Beebe doctors that now have offices coming from throughout the county. So you'll hear coming up in the next month how we started our Cardiothoracic Institute. I know that there was another health system that had a Cardiothoracic Institute start a month before. Great, because we need all the doctors we can get. But I will tell you that our Cardiothoracic Institute that we will announce brings in 4 new cardiologists to the area. So we're not circling everybody and bringing them into a different office. We're bringing in 4 new cardiologists. One of them just arrived. His name is Dr. Andy Foy. He's a medical cardiologist from Penn State. And when I say a medical cardiologist, there are 2 basic kinds of cardiologists. They're the cardiologists that have the training, extra training after cardiology school to do the cardiac catheterizations, to put the needle in and take care of the blockage and stuff like that. There's another kind of cardiologist called a medical cardiologist, which is still you go to cardiology school, cardiology residency, and then you do fellowship training on things like hypertension, high blood pressure, heart failure, lipid disorders, and all the things that can have an impact on your heart, but it's not something you operate on or treat with a catheter. We're bringing those people in, and those people will have offices, maybe not permanent here, like every day, 24/7, unless it turns out that that's the volume, but certainly we'll have rotating cardiologists through there, as well as other kinds of doctors. You'll also be hearing about our Neuroscience Institute, where we're bringing on a new neurosurgeon from Jefferson, who will be here 24/7, 365 in Sussex County. That's a lot of patients that no longer have to be flown up to Philadelphia. And I know that everybody asks me all the time, well, didn't you have to go to Jefferson when you had your stroke, Dr. Tam? What's wrong with Beebe? Okay, here's the real answer, okay? We actually now, when I got here, everybody with a stroke had to be flown out of Sussex County to go to either Christiana or Jefferson or Penn. That was 5 years ago. We partnered with Jefferson to be developing our teleneurology, telestroke network, where now a neurologist from Jefferson is on the line right away, looks at your scans through a special, it's not a robot really, but a technology platform, can help decide whether or not you should be treated, with the medication, the clot busters. And actually now, 5 years later, we keep 95% of everybody who's had a stroke here in Sussex County. We don't send them up to Jefferson. Now it's at Lewis right now, and we have plans further for that, but that's a different town hall. But I will tell you that what we have to do though, because we are a community hospital and health system, is when somebody has a stroke like me, and then they look at the scan and they say, there's this funny schmudge on one of your blood vessels in your brain. It might mean that you have a tear, and that's why you had the stroke. You need to go to Jefferson for that. And by the way, we at Beebe agree. You do not want a local independent community health system or hospital, as good as we are, to do that kind of intracranial surgery. Those are the people we fly out. But the good news is, because we have a partnership with Jefferson, we'll know that right away, because the Jefferson docs are going to be online. Now, why do I say that? Because at that emergency room, you'll have the same capability. There'll be a Jefferson teleneurologist. So if you have a stroke, if you feel that something's not right, you can call an ambulance or have somebody drive you over there. And within seconds of getting in, the protocol will apply just like it did with me. You get your CT scan. And by the way, there will be a CT scan. I think we're also planning out an MRI, right? They'll evaluate you. They'll do your blood work. They'll check your EKG. And the neurologist is on the screen. And if it turns out that you had a stroke and there's a determination only a neurologist can make, then we treat you. That's really important for you to know. Because if you don't have that, you'll be driving someplace, and for every second that you don't get treated with a stroke, you lose brain cells. I think I was treated quickly enough. My wife thinks I lost a couple brain cells no matter what, but what are you going to do? That's the important thing that you need to know about why it's so important to build that. And the ability for people to come in from anywhere to get that care, have a CT, get MRI, is critical for you all. Okay. Now, there's also going to be, like I said, cardiac, neurology. There's also going to be other specialty services that we will have there in the clinic, and we know that we will have to continue to grow. So part of the planning process, and I'll stop in just a few seconds, is how to make sure that there is an opportunity to expand, right, the services that we need, because you will ask for that in another year or 2 years, and make sure that we're not landlocked, while at the same time making sure that we use the land as best as possible. So you can see that site plan up front. This is something that's been presented to the council, right? And I think we've already gotten approval for the site plan. Paul, is that right? Yeah, right? Yeah. So, we got to do a final, but I think there's no change in this at this point. And you can see once again, the way we are doing this and building it out. To be frank, I don't know yet. I know, Paul, do we know yet whether that area, now that we know where sheep pen is, and then the line that we set as a demarcation, is that something we can build on, or do we not know that?
We're unsure of this triangle right now.
And so do you understand what Paul's talking about? Since we didn't know what was going to happen to sheep pen, there's this area. How many acres is that?
That's like 3 or 4.
Yeah, I mean, 3 or 4 acres of, it's going to be hard because you're not going to be able to park on this road, right? And then come down, but you can come down on this road. And do we build something there or do we not? Right? These are some of the considerations that we had the opportunity to really think through, because we didn't know until recently exactly where this road was going to go. And then if we had the permission to build on that. Does that make sense? Okay, next slide, please. That's what it's gonna look like. And if you wonder, are you kidding me? Just go to Long Neck, go to a Long Neck clinic, go down to Millville and look at our Millville ER on Roxana Road. Even if you go to the Rehoboth campus and look at the hospital, you can see the renderings all are pretty similar. There's two reasons for that. Reason number one is because we want to design facilities so that when you come to one, you know that it's a Beebe facility. Okay, it's like the Golden Arches, but you know what I mean. Okay, my board chair is a big McDonald's guy, so, but if you understand what I mean, you know, when you see a Golden Arches, you know what you're getting, you know what the menu is, you know the process, right? That's what we want for people at Beebe Healthcare, that they see it and they know, oh, that's a Beebe Healthcare facility. The second reason why they're all designed a certain way is because we're not rich. We can't build something that's a, you know, big class and everything, because at the end of the day, we have to watch our pennies. Building something that's similar in other places allows people like Paul to figure out how best to budget and how best to do things like buy construction material or glass or things like that, right? So this is the way it's going to look. And personally, I think it looks pretty good. But like I said, I was in the Navy and, you know, cinder block gray looked good to me before. All right, almost done. That is the last slide. So let's go back, if you will. Can you go back to the a little bit more for the other one? Is that the, yeah, no? Let's go down. I'll stop here and say our goal today, and I'm going to be hopefully listening and answering your questions. Now that you know the conditions by which we are making decisions as best as possible, is this. When we get told, get the final, no pressure. We're gonna start working. When DelDOT says you're clear to go, bring in your bulldozers and whatever, and you can use that hard scrabble and sheet pen, we're ready to go. We're gonna work on building this. Now, I don't know if anybody's in construction, and you know I'm not, but Paul will tell me that at the same time, it would be kind of nice to know a little bit about what we're going to be doing on that other end, right? Because maybe there will be a change in the road. Maybe we'll decide that there has to be some walkways or something like that. You know, if we want to build a store, retail store all the way at the other end, that's going to change the road movement, because there's only one way to get to that tippy end, right? So it is, though, where we are today, that we're ready to move forward as soon as we get the green light from a variety of government agencies. And of course, as soon as I figure out how to pay the contractor for the things that we do. We have a budget. So I'll stop there, because the goal now is to ask you. You have a say in what you want. I cannot promise you, because I think I hopefully did enough to share with you the considerations and some of the challenges that we have. But we want to hear from you about what you would like to see in a community health center, right? And it doesn't have to be just medical offices buildings or an X-ray or an emergency room. I'm done. So I don't know how you want to do it. You want to raise your hand and we'll pick. Because I don't play golf, but I recognize the Callaway hat. Okay, what's your name, sir?
Bob from Plantation.
Hi, Bob.
Question, it's also gonna be a phase 2 and phase 3,
Phase 2 and phase 3 of
this whole field.
Paul?
So, just so you know, the phase 2, 3, 4, 5, 6 could be all in here, but this building actually, this building actually has expansion. We've designed it in such a way that we could actually pop onto the back of it. So that we can use the back half of the building. So we put some thought process into moving this building and actually building right on the back of it. to keep all of the utilities and everything in place. And so this piece is a phase two that expands depending upon what we can do in this space.
Go into those buildings.
In this
Phase
piece,
two, phase three.
So it could be more medical office buildings, right? It could be, it could be an expanded ER if it turns out that way. You know, there are some things that you need to know. If you want to do something, you still have to get state approval. Back 3 years ago, I got the state to approve, it's called the Health Resources Board, building an ER. Believe you me, I had a lot of people from other places object to that. Okay, but we got that done now. So if I may, doing things like, for example, a skilled nursing facility or a small micro hospital or something like that, or even an expanded ER will require us to go back to the state. We can't just say, yeah, we can do that. What we did do though, is make sure that we are prepared mechanically and from an engineering standpoint, that if that is what the need is, we could then go to the state and say, there's a need for that, and we can do that at minimum cost because we don't have to like tear the whole house down, right? That's how you build some modular houses to make sure that you have the ability to break a wall and you can build another bedroom.
Something in the very near future planned for phase two, phase three. There is something that's going to be built there, but
It's the unknown.
That's unknown. That's unknown. I'm being perfectly honest with you because, but it's going to be in that area. It does not mean all the way out, you know, where the rest of the green space is.
20 acres left.
Yep, you're right. You're right. But you know, all that will depend on the dynamics of what healthcare looks like, the population growth. You know, you guys grew by 10% in 3 years, right? And
Here, 12 years.
well, there you go. So you came before the big growth. So anyway, does that answer your question? I'm being very upfront with you in that.
Just curious about the phase two and three.
So there's two phases, if you will. There's a healthcare phasing. And then there's also a phasing of the campus, right? Because even if we decide, from what you tell me, we should put a park there, or we should put some restaurants there or retails there, that would be a different phasing of a different part of the property, okay? Other than what we've talked about, phase two, phase three, which is of healthcare and clinical construction. Does that make sense?
You're planning for the future.
Absolutely. I mean, we'd be crazy not to. Okay, sir.
Dr. Finn, could you either repeat the question or hand the mic so people online can hear?
Absolutely. Thank you.
Hi,
And then you next.
my name's Gene,
Hi, Gene.
Plantation Lakes. And I'm just wondering, you touched on it a little bit, that primarily this is an ambulatory care facility. But will you be moving upscale to make it something like a trauma unit? Because we need more of that here at the coast.
Absolutely. You are right. You need that. A trauma care facility, a trauma center is not simply a bigger building. As you know, you probably already know that. Oh, by the way, the question was, are we thinking about potentially expanding to a trauma center or trauma? You know, you'll need a certain number of neurosurgeons. You'll need a certain number of trauma surgeons. You need different kinds of ORs that are open and do nothing and staffed, but do nothing but wait for a trauma to occur. And a variety of different things and certain kinds of beds and certain kinds of certification. So you're right. It is something that we recognize as a need, especially when you think about some of the industries that we have around here. And I would tell you that if we did at some point say, boy, do we need a trauma center? That would be a different kind of phasing. To do that, we'd need to have a real hospital. You can't have just a trauma ER and that's it. You'd have to have ICUs. You'd have to have intensive care doctors. And so I would tell you that if we saw that need, and if our EMS colleagues really thought that that had to happen, then I would be coming back to you and saying, we might need a little bit more property somewhere that we could figure out how to do something about. But I don't think it would be there. Is that
That's fair. That's fair.
okay? Because it's a heavy lift, you know? It is a heavy lift. One of our challenges is not about land, and it is about money to some extent, but the amount of physicians, and not just physicians, but you might have heard me talk about it, but for every physician we bring on, you have to bring on 6 support staff. Right? Lab techs, pharmacy techs, ER techs, OR techs, housekeepers, food service workers. It is one of the reasons why, by the way, we are thinking about expanding into Millsboro, not because of competition or anything like that, but because our staff live here too. Our staff live in Plantation Lakes. Right? And we don't want them to drive an hour to get to work when we have a 30-minute requirement for them to staff our ORs for a cardiac procedure or a trauma case or something like that. So there are multiple reasons besides the fact that it is for community service, why we are looking to move forward into places like, a little bit further west, like Rehoboth, and then, of course, further down into Millsboro. But that's a great question. Thank you. I think, ma'am, you were here, and then we'll go there next, sir. What's your name?
Lynn.
Hi, Lynn.
I am probably your closest neighbor from Plantation Lakes.
Really? Can we see your house from there? Just in case I have to use a bathroom next time. Okay, Lynn? Okay. Yes, ma'am.
Every view out of every window in my house is going to be your building. My question is, what's all of this going to be? Because that's gonna be my view every single day.
Yep. So Lynn asked the question about, I hope I can paraphrase. She lives right there. Out of every window is that orange building. It won't be orange, by the way. Okay. Which would be good unless you're what is it? University of Tennessee? But how are we going to make sure that we protect and preserve the visual sanctity of your home, right? I understand that. So 2 things I think we should start up. We really understand that. And so I don't know if you've had a chance, for example, to go to Rehoboth recently. Were you? We worked very hard with the developers, and in a way, we were doing it backwards because we built that place when there were no development, right? To preserve all those trees that we could, so that they could make sure that it screens out the views of the hospital. So we will work really hard on making sure that we do that as well. There's actually the opportunity for some, and that's why we're talking, because
I mean, it has to be a berm and a fence.
Well-
There are no trees there.
you're right, we actually have to build more, but that's one of the reasons why we're talking, because depending upon what we build here will depend upon the road access and what kind of road that we build, right? Because there's no road unless anybody here from the homeowners association at Plantation Lakes? We might have to come talk to you guys about how we connect a road here or someplace else that makes it easier for people to get to a retail or some other kind of service there. That would lessen the road access this way. But that's why we're here talking. To answer your question, other than the fact that we have to try and assure you that we will do everything possible with vegetation and trees.
Someone's gotta say, this is how we solve that problem. They're gonna be-
Well, let me ask you a question, and I'm sorry, I don't mean to put you on the spot, sir, but what's your name? John? Ron, I'm sorry. So Ron, that is a question I've asked, and I've asked Jamie about it a little bit, like, how do we make sure that now we connect with the homeowners association to do the best thing we can to communicate? Because there are some people, with all due respect, that may be more impacted than everybody else, right? And we want to make sure and be as respectful as possible to what Lynn's concerns are or with somebody else's concerns. Everybody will have a concern about that. So go ahead, Paul. Go ahead. So we will, to answer your question, the question was, how do we make sure and communicate with the people at Plantation Lakes? We will need to rely on the homeowners association. And it's just one homeowners association or different? Right? And gonna get in trouble. Homeowners associations are a very challenge. I salute you for being on the homeowners association board, because you know, everybody has a different opinion about what we need to do. But we will work with you to figure that out, even if it means how do we change the traffic pattern even more? That's one of the reasons why on the next slide over, can you go back to the other slide? Look at that. We're even talking about going back to Del Dot about whether there should be a different road, right? You see, that's why we're here today, by the way.
He said absolutely.
So let me,
Section.
can I just,
I was big concerned
So
that
that's
it's
a-
gonna be a dumpster.
where's it? This way? So let's just, so you had the whole oversight, right? And this was just a preliminary site plan. We haven't gotten into the vegetation, but all of these are trees that are gonna be installed in this location. And there are lights here too, but they have the down lights, so it's all been photo cell to make sure that we don't broadcast. The other thing too, I wanted to mention, you know, with the HOAs, if you go over to our Long Neck site, we had an HOA next to us. And there were some raggedy trees and stuff, and it was a buffer, right? But it wasn't the buffer that we wanted, and that HOA president came and spoke with us as well and said, hey, what can you do for us? And we partnered with them, and we actually took and put a fence up the entire way to work with our neighbors. We wanna definitely see the needs, see the concern, and then actually see how we can address it together and figure it out. But this is all trees, all entire, fully set up with trees. And again, until we know what this pattern is up here, this will continue on. So there will be a buffer.
So I'm gonna ask for a little help here. Is there a council meeting tonight?
Next Monday,
But, you know,
Next.
Monday.
okay, good, because I don't want to keep you guys here and avoid the council meeting, because there will be more questions. Here's what I'm gonna propose also. This is not our first one, okay? And there may be from this a action plan on other ways to get information. And I know there are many questions. Brian Marshall from my communication team is back there watching to make sure that I don't say the wrong thing. But I'm gonna ask Ryan to also keep an eye out on who's asking or who's got their hand up so that I don't miss you, right? And you know, it's not like school where you have to keep your hand up until Mrs. Smith, you know, calls on you. Is that okay? So raise your hand if you have a question. And then if there are some things that we need to go further, thank you, we'll be right with you. Then we'll also set up, Diane is taking notes so that we can kind of follow up a little bit about what are the key areas. And it might be a community meeting about that part of it versus, yeah, we want a restaurant, but someplace else, you know what I mean?
To some of the fears.
Yep.
In that whole corner section.
Yep.
I mean, there's a lot of concern.
And that means potentially going to Del Dot and saying, listen, the citizens really don't want every ambulance driving down that way. So we want to put a road there. And what do we need to do to make that happen? And don't forget, part of the reason why you're there right now is because we bought the whole property and then sold you the piece that you needed. Right? Hint, hint, nod, nod. Okay. We got you, but your hand was up, sir. What's your name? Rick? Rick from Plantation Lakes.
Generally speaking, there's 3 hospitals, 30 minutes in various directions from here. They're full bed hospitals. And obviously, there's a growing need for this area. Out of the 3 different, or actually now 2 different operators of those facilities determine when they put in a full blown hospital, what's the requirement, and you know, how close are we to putting a full blown hospital, full bed hospital in this area. Okay, you don't have to drive that 30 minutes.
So we work closely, Terry Murphy from Bay Health, and Steve Leonard from Tidal actually, which is the actual owner, the Maryland owner of Nanticoke, right? So it's not, Nanticoke is not an independent hospital anymore. It's part of a system that is managed out of Maryland. And so I work closely with them and, you know, we're not like keeping secrets like, okay, what are you gonna gotcha, right? It's one of the reasons why by the way, you might think, oh, the reason why Beebe's here is because, oh, suddenly Tidal broke ground and so Beebe's trying to keep up. Okay, it may seem that way, but the fact of the matter is, as I shared with you, we've been waiting for a long time about Sheep Pen Road. The other difference is they don't have an ER. Okay, they didn't need approval from anybody to do this. We got state approval 3 years ago. So to answer your question, the other part is we work closely with the state. Right, with who's your state senator? Is it,
Betty
Sorry?
John and Hawk.
Eddie John,
yeah,
And Hawk.
thank you. And your representative is,
Rich.
Collins.
talk to them also, and say, here's what we need. It is one of those interesting things, and Rich. Healthcare is changing also. And we are working really hard to make sure that we don't have to have as many hospitals as possible because we don't need as many. That said, when you need one, you need one. And by the way, that's one of the reasons why, if I was a competitive SOB, I'd say, let's put a hospital there. Right? And Nanticoke, but I didn't do that because I worked with them and I know that there is a hospital there and there's an emergency room there as well. But even then, between here and Nanticoke is at least a 35-40 minute ride. Right? So I think everybody agrees it's the right thing to do. But to answer your question fully, we work very closely together. It is a huge financial investment. And one of the things we are looking at is, actually you talked about the 3 hospitals. What'd you talk about? Bay Health in Tidal. And Atlantic General's gone now, right? I don't know what's going to happen with them. And I love them to death. And of course, don't forget, there's a Rehoboth Hospital. So as the area grows, that hospital, which started off as a surgical hospital, we may have to think about how to do something different there to continue meeting the needs of the community. Okay, every hospital in America loses money. That's a fact. I'm nonprofit, but at the end of the day, if you're nonprofit enough and losing money enough, you end up being what happened at AGH or Crozier, if you know what happened in Pennsylvania, right? We're not going to do that. We're going to stay here for another 100 years. So I hope you know that we do talk and we work very closely and look at the data. I think this young lady had a question. Is that right, Ryan? And then this young lady after that. Yes, ma'am.
Hi, I'm Joe from Plantation Lakes. And here's my question. Given the fact that there is real concern for Medicaid and could spill over a little bit into Medicare, have you thought about a population health program at this location that could address in a less costly clinic setting, things like diabetes, congestive heart failure, those items that are pervasive, that if you could do something with those patients to help them along, it would actually lower your ED admissions and also hospital admissions.
So I'm sorry, what was your name?
No, it's not.
What was your name? What was your name again?
Joe.
Joe.
But I have something different.
But if I may, I'm just saying that if it wasn't inappropriate, I'd hug you.
Thank you.
Because that is Beebe Healthcare's mission, right? That's why we're not just going full hog into building all kinds of big hospitals or clinics or things. What we have done is built community-focused clinics. Beebe's strategic plan that Dr. Hall and the board gave me was we need to be 20 minutes away from everybody in Sussex County. In one of 2 ways. One, if you're driving, right, 20 minutes away. We have a place in Selbyville too. We have a clinic in Selbyville that's not a clinic, not just a clinic, but a pediatric cardiology clinic staffed by Nemours doctors, right? And we're looking to expand that. We have a place in Millville by the sea on Roxana Road. That's an ER. The ER there is almost as busy as the ER in Lewis, okay, on an annual basis. And we're getting ready to figure out what to do about the 30-some acres. We'll have another meeting there with Roxana. And also Long Neck. We're going to build more medical office buildings in Rehoboth. And I will tell you, I'm very proud. We just built a new medical office building in Milton on the Milton-Ellendale Highway. Anybody drive down the 16? Is it the 16? Yeah, not the 30. And there used to be nothing when I flew into Maryland and then drove across the bridge. And there was Kemp's Liquor and I knew I was on the right track. Now, actually, there is a new 40,000 square foot medical office building there on Route 30 to serve the people who live there in Milton, fast growing. you guys better watch out, because it's gonna probably grow faster than Millsboro, right? And but what's really important is it's there because we need to make sure that the people who live in Ellendale and further west, right, get that population health care. So,
Well, I don't mean to interrupt.
no, you can interrupt.
My focus was on that preventative.
Yep. So that's why you may not have been here when we started. That's why we're building something with our medical offices on the second and third floor, and we have a very robust population health and community health program. If you've been to any of our, events, you know that there's somebody always, like at Dagsboro at the fire hall, all that, there's somebody checking people's blood pressures and making sure that their blood sugars are okay. But do you know that there's now a pinprick test for prostate cancer? Because you and I both know that before, prostate testing included a different kind of finger testing. Like, now it's a finger prick, not a drop of blood. Those are the things that we want to do there. And one of the reasons why we're here talking, because you've been asking me about the site, but you haven't told me yet what you want there, is wouldn't it be great if we had a place where the community could congregate for whatever reason? And Beebe was there, not having to drive someplace or take the mobile clinic to say, hi, we just opened up come on in, get your blood sugar tested, get your hypertension tested, and let's connect you. The other thing that you need to know is, okay, so this is my wife and my dog, but ever heard of Epic?
Yes.
Epic is the electronic medical record. It is the world's #1 electronic medical record. Okay. What's exciting about it for me is Beebe Healthcare over the past, I don't know how many years, decades, has tried to figure out how to put 7 electronic medical records into one. This year, or 2 years ago, we, with once again the board's approval and support, said we're going to go ahead and buy Epic for Beebe. It is a $50 million proposition. It should be going live on November the 1st. Of this year. We're right on schedule, right on budget. Here's the reason why it's exciting. It means that wherever you go now in the county, wherever you go to one of those buildings, or even if you go to Jefferson or Penn or Johns Hopkins for any other kind of care, you'll be able to access your medical record on this device. Your doctor will be able to do that too. Okay, it's called MyChart. So when you heard me talk about how the board has asked me to do 20 minutes from, from your home to get to a Beebe site, it also includes something I call bricks and clicks, that you can do it from your phone. You can do your prescription from your phone. We bought a pharmacy. Did you guys hear about that? Cape Pharmacy, which is at 5 Points. And yeah, I know you're like 5 Points. That's way the hell over there. But the reason why we bought it is because hospitals and health systems have to have an outpatient pharmacy license to be able to dispense medicines to you on an outpatient basis. So if you were in the ER, I could give you all the medicines you need, but then if you were now getting ready to be discharged, you're like, why am I getting a paper prescription? The answer is because the hospital or the emergency room cannot give you the medication that you need for being an outpatient. So we bought an outpatient pharmacy because our goal is then we have the license. And the idea is you should be able to be, when you get discharged from the ER or from the hospital, for us to go downstairs to the other part of the pharmacy, right? There's a little wall and it says, okay, now here's the prescription, outpatient drug, and have it brought up to you. So when you leave the ER, you have a prescription so that you don't go to a Walgreens or a Rite Aid. I'm sorry, I can't be Rite Aid anymore. Right? That's what we're trying to build here. And so nobody's asked me, are you going to put a pharmacy there? So anyway, but to answer your question, that's the community focus. That's why we're here talking, because love to have your thoughts about what else we should build there that would bring the community. And it is a huge committee, Plantation Lakes, but with all due respect, I'm sure that the I'm a Baptist. My dad was raised a Baptist. I was raised a Baptist by my dad. So when I say congregation, I get all kinds of, bad vibes. But we need people to be able to congregate at a place for other reasons and then say, come on in. Right? We have equipment here, so you just give us your a blood drop and we'll check you out. And then, by the way, it's no longer a piece of paper that you go and say, here you go, put in your files, but it goes into your My Chart. And it will be available for you, whether you go to a Tidal facility or a Beebe facility or a Bay Health facility. Christiana doesn't have it yet, but I'm not competitive. Does that make sense? Okay. Ryan, who else? Yes, ma'am.
Thank you.
And what's your name? Kathleen.
Answer the question about the pharmacy. Is it gonna be a full-scale pharmacy where we can bring prescriptions from our doctor?
Yes,
Okay.
yes. I mean, how many of you have gone to Cape Pharmacy in 5 Points? Is that me? Okay, it's all right. Just want to make sure that my wife isn't calling me. But if you haven't, I'm sorry, if you have gone to Cape Pharmacy, it's not just a pharmacy. They sell other kinds of things, regular over-the-counter drugs and medication, right? As well as durable medical equipment. So things like walkers or other devices that many times Medicare pays for, that you shouldn't have to pay for. So yes, ma'am. So I'm sorry, go ahead.
Once Delgado is finished.
Yes, ma'am.
They open Fine Scrap. Is the BB construction going to close Fine Scrabble again?
You saw me. It's like, well, I feel like Laurel and Hardy. I was looking at Paul like, well, what do you think? Do I find another fine mess you've got me into, Ollie? The answer is no. The answer is no. We'll do everything we can, but that's one of the reasons why I'll be very what was your name again? I'm sorry, Kathleen. Why we're doing this as fast as we can, because it requires staging. To build stuff requires a plan. What are we doing over there? What are we doing over here? Where does the equipment go, right? How do we stage the big machines? That's what he needs to know, because if we don't have that plan, then we're like, oh my gosh, we have to close Hard Scrabble now for a couple days because, we didn't plan it out. Does that make sense?
Yeah.
That's where we are. And by the way, just so you know, if you've never been to the Cape Pharmacy, you need to know that we also compound veterinary medicines. Somebody asked me if we should start a vet ER, because boy, I was at one just the other day and they make a lot of money and do important things, right? My poor cat. But the Cape Pharmacy compounds the vet medications for everybody here in, at least on that side of Sussex County. Okay, are you okay with her asking a second question? You sure? Because I don't want anybody giving me a hard time that we went out of turn. Kathleen?
Just about what percentage of Medicaid patients are in Sussex?
Yes, we do know. Diane, do you want to? She's the data geek. But only she.
Wow, so that's a tough question.
Well, I can give you some
So
information.
some of the statistics, I can tell you. that
Microphone,
approximately-
yeah.
Oh,
Microphone.
so the question was that Kathleen asked, how many Medicaid patients do we have in Sussex County? Is that right? Okay.
Yeah, so the number is a little more challenging, but I can tell you at Beebe, we serve approximately 13% of our patients are Medicaid patients. When taking a look at that and understanding what's coming in the new bill, we believe that 4 to 6% of those patients that we currently have will lose Medicaid coverage. And right now, I think we're projecting that will potentially increase emergency department visits by approximately maybe 2,000 per year. Because those are folks now that won't be able to get their care the way that they traditionally have gotten it through primary care and other means. And they will end up showing up in the emergency department once disease has progressed. So, and we are looking into it further, but it's a big question that we're trying to answer for the entire county.
So, you know, pretty soon my job will go away because Chat GPT will be running it. Okay, but I can tell you that from what they say, right? Medicaid in Delaware is about 10% of all patients. Right? How many people are in Millsboro?
8,400.
Right? 8,400, and that's grown from like 6,900 or something like that.
And that's just the municipal boundary.
Right?
Yeah.
Right.
I count you, Dr. Hall. What that means is that there'll be about 1,000 people without insurance anymore of any kind. We already have a plan on figuring out how to make sure that we help those who lose insurance, Medicaid insurance, by having some kind of a grant that helps us find people and say, hey, I understand, I noticed that you don't have Medicaid coverage anymore. Can we go with you to help figure out what the workforce requirements are? How many hours do you actually work? How do we document that? How do we help you fill out your paperwork? And so we hope that we'll be able to do that as well. And that requires, once again, electronic work, technology. Okay, thank you, ma'am. Who's next?
Wait, do you mind if I did Chat GPT also, in Sussex County, Delaware in 2023, approximately 21.5% of the population is covered by Medicaid.
So there you go. Thank you, Steve.
Sorry.
I'm going to take one quick stop here and say, are you guys okay? You know, I could talk about Beebe Healthcare and how excited we are all day long. It's part of my job description as CEO. And although I'm an introvert, I love talking to the community about this. So I could go all day long, but you guys are like, just shut the heck up. But so let me know if we're doing what you need and answering the questions or giving you the opportunity to do so. And this will not be the only time. So who was next, Ryan?
We actually were open floor.
Open floor.
Real quick, we do have people online. I don't know if you want to ask if anybody online has a question.
So is there a way for you guys to keep an eye on, is there like a chat function that's?
Yeah, I mean, they could, if you ask if anybody has questions online, they could chat in and.
All right, we'll do that too.
Thank you.
I think, sir, you had your hand up a couple times. So who are you and what's your name?
I live in Plantation Heights, go back to the barrier. I've built commercial jobs before. Maybe won't get away, build hospitals, one of them John Hopkins. But the barrier that visually is a big problem. I think everybody's real sure. You only show it going back to the back end of the facility right now. But if that can be extended and treat that barrier as a first phase instead of the last phase, because I know vegetation, because then landscaping is difficult. The last thing you just, all the construction be done, pavement be done, and here comes landscaping. So that barrier, I think, can be treated as a separate entity.
I think, Richard, we will look at that phasing approach, but I'm going to just say one thing if it's all right, because you were in the construction world. So you said you built something for Johns Hopkins?
Yeah.
You got a crap load more money than we do. And so one of the things that's important for us as part of our phasing is knowing how to start generating revenue so that we can continue to pay for continued building moving forward. I understand what you're saying, but please believe me when I tell you that we take your consideration very seriously. But as basically, I don't know if you know this, but Beebe Healthcare is like a family business. Okay? We are a family business. And as we grow and our family grows, we have to build more bedrooms. This is one of them, right? You know what happens when you have to build another bedroom or buy a bigger house? Anyone? Oh, your taxes go up. We don't have to pay taxes. We're nonprofit. But you do have to pay a higher monthly payment, right? Sewage, the UDA thing, right? Electricity, all that. So please know, I mean, I don't mind telling you, we are always at or near break even. We are not one of those places that makes 10% margin every year because we don't have research. We don't do a lot of stuff. We are a community health system. And I'm kind of proud to say that. But what that means is we respect what you're trying to do and trying to say, but I hope you will understand that as we make decisions, I'm just telling you straight out, we gotta figure out how we're making money from day one, not because I get a bonus. Right? But because that's how we continue to grow. We've got to grow, by the way, in Millville. That place is growing like crazy too. Right? And we have the land, we put that together. We have to grow in Rehoboth. Part of the reason why, by the way, we are doing this is not necessarily just because we care and love you. But I told you, 3 ambulances from Millsboro drove to Lewis. And when you go into the Lewis ER and it's full, and there are patients waiting, right? And we take care of everybody, right? We prioritize and triage them based upon the medical need. Lewis patients are, I won't say compete, but are sitting next to Millsboro patients. By taking Millsboro patients and keeping them where they should be, close to home, especially if they don't need immediate hospitalization, right? It's an opportunity to help the entire community, whether it be Lewis or Rehoboth or Millville.
So just the
They don't-
the elephant in the
because he
room.
knows I need a Diet Coke.
Yeah, just the elephant in the room. Can you go to the other slide that had the overall plan? So I'm not gonna do any excuses or anything, but there's quite a distance between here and here and here and here. But again, we haven't kind of vetted this whole thing out, so if this does have to get extended, we're gonna make the buffer anyways. Similar to the long neck facility that we went and did, but the other 2 elephants I wanna talk about, cause everybody asks. Go to the other slide now, sorry. For the people who fish, this is not gonna be a fishing pond, so it was another question that was asked several times. It's actually gonna be dry based on what we found for our analysis of the excuse me, of the land. This will actually be dry. Maybe this afternoon it might get wet with the 2 or 3 inches of rain. And then the other one too that comes up all the time is this little square here with this little funny looking sign, the helipad. So the helipad, there was a little excitement last time about, hey, how many times the helicopter gonna land? So normally, it's not gonna be very often, only because they take the helipads, the helicopters, and they go right to the point of the accident. It would be a point, and Dr. Tam, again, I'm non-clinical, he tells me to build it, I build it, so I'll start saying things that I don't know about, but this would be used maybe once a month, if that. Because again, they take it all the way to they'll go right to the site where the accident is and land in a cornfield or something. So this is just, but we have to have this to have an emergency department. So it's both. You have to have both.
So I'm gonna take a quick stop and take a question online. Is there one online?
Yep.
Okay, so if you're online and you wanna ask a question, you go into the chat feature, is that right? And type in your question and we'll be happy to answer it.
While I was speaking, Dr. Taylor.
Who went first? Okay,
Taylor Scargo, I'm the CEO of the Health Relocation in Georgetown.
Yeah.
Neighbors to the north. I'm curious, I love the movement aspect of it, down in the bottom left hand corner, it looks like there may be a second entrance. And I was surprised to see only one traditional or obvious entrance to a hospital, and a lot of them have 2, so I was curious what the plans were for that.
So we're in talks.
by the way, that was Pam asking about whether or not we should have a second entrance to that emergency room campus.
So thanks for bringing that up. So we did have that issue coming into our first initial site plan. Delbot only allowed us 1 entrance. We came back in and said, we need the second entrance. There's no way that we can't. So this is now under, they first said no. We went back and said, remember all this land up here? No. We went back and said, but no. And then we actually, I believe one of the chair people is on the fire department as well. And the fire department agrees with this. So I think we'll have enough not ammunition, but we'll have enough facts to know that we do need this second entrance. So there will be a second entrance.
Excuse me, Paul. When you need that second entrance to, when you do your expansion and your construction vehicles will go down that way rather than through your main entrance.
That is correct as well.
And bringing that up, wouldn't this green area be your lay down area when you're doing your initial? So this is another reason why I think a lot of the folks who live in Plantation Lakes would love to see that buffer
continue past it because you're still gonna have a much of the.
And quite frankly, and again, working with the community, we're not gonna put the laydown area right here. We're not gonna have construction vehicles sitting in your backyard. They're gonna all be up in here. We have control of the entire site plan, so we will tell them, you're gonna fence this area off and this is where you're gonna work.
True, but this whole area, and visually, you can see right down to the construction site.
I'm sorry, what was your name?
Stephen.
Stephen.
That's okay.
Stephen raises a good question. We don't have an answer. That's why we're starting off the series of conversations. Because once again, as you know, because it sounds like you're in construction, right? It's still based upon staging. And what are we building and where? I mean, I'm a pediatrician. I don't build things, but I will tell you, what I learned was you gotta have this whole plan laid out as best as you can, so you can figure out the different staging areas, right? And the access to that staging area, and that's why we're here. I still need to know what people think about what they want. Because otherwise, I got tons of ideas. But like I said, we're a community health system. And we're interested in wellness. So thank you very much. Who else? Yes, ma'am.
I'm here.
Really?
When you transition over that, will your existing record also transition?
Yes. Everything will transition, and part of the plan is actually, isn't it? It's kind of like when you're moving from one house to another. You can't just all move in one day. So actually, we keep all the data from all the other systems for a full year and migrate it over. Okay? One, because if there's a problem, then we need to have the data, but two, because it takes time to migrate all that data over. But yes, it will all move over and be one portal instead of, is it Athena? Is it Cerner? You know, which making your own appointments. There's a goal for us to get to the point where you can make your own appointments online, not have to call if you don't want to. Help. I know we're Sussex County, so if you want to call, you know, it's funny. There was when you're at Wawa and you're the CEO of the local community hospital, you will get stopped. Dr. Tam, I've been trying to get an appointment for primary care. I can't do that. It doesn't work. Really. So I went online and I did swear to God, it was not like planned. I went to the Beebe website, got the phone number, because right now we can't do that. In the future, it will be done electronically. Here's the phone number. I called the phone number in front of this gentleman. And hello, Beebe Healthcare, can I help you? I did not say, hey, this is the CEO. I said, hi, I'm a 65-year-old guy with diabetes and I had a stroke and I'm new to the area and I'd like to make an appointment for primary care. And you're a new doctor, right? 4 minutes later. I know that sounds like a long time, but 4 minutes is pretty good. Okay. She came back and said, well, we don't have anything in Lewis, but would you be willing to go someplace else? Yes. Well, I can get you an appointment in September in Millsboro. That's for a 1 hour appointment. You know, and to be able to now start thinking about doing that, now that we've built all these clinic sites where there's capacity, and then have the ability to connect electronically if you want to, is where Beebe Healthcare is going. So, does that answer your question about the record?
That does.
Yes, ma'am.
I know you said that you got access to that helicopter and, but don't plan on using it all. If needed, could you transport a patient from there to Temple?
Yes. We do it all the time. Now, it's not like, hey, you know, Uber Health, right? There's a clinical need for it. If the ambulance, and one of the things that it was, can you transport a patient to Temple? Well, let me tell you a couple things. You know that all these health systems and how we interface is through like contracting, because at the end of the day, it's about who pays for it. Okay. We actually have a great relationship with Jefferson Health in Philadelphia. They give us head of the line privileges. If someone has a stroke in one of our campuses and they're on the line, part of the reason why they're on the line is because then like, okay, we need to transport you. And no, you're not the CEO, you're just, you're just somebody who really needs care. They can then tell their own people, get a bed ready, because we have a patient coming in. That's a kind of relationship that then to some great extent dictates the helicopter transport. And then we also can negotiate those transportation rates, so you're not hit with a $50,000 bill at the end of the day.
That's it.
No. Sorry. That's one of those areas where, as you know, when you get called, when an ambulance is called, the ambulance does ask, where do you want to go? Right? From what I see, seeing all the ambulances, and most everybody says, I want to go to Lewis, I want to go to Beebe. That's okay, not a competition. But I will tell you that when it comes to that kind of a secondary transport process, there are other reasons why we're careful. For example, what if you were saying you want to go to Temple, but then when we call Temple, they don't have a bed available for that kind of thing. So it's clinical as well as insurance.
Yeah, I'm not saying it's just because it's my preference.
Yeah.
I'm treated there because I have a lung transplant. So they would want me to.
Yep.
If there was an issue involving that, it would be.
So I think that that's something then when you get to the ER and there is a need to transport you, that is a consideration that people would make, recognizing that Temple may be the place that you have to go to because that's where you got your transplant. Just letting you know.
I'm wondering if that would be.
I think that would be a consideration. Of course, my response is it depends on what you think. If you think that you're sick and you're dying or you need help, go to the nearest emergency room. If that turns out to be something where you could have waited, then you could either get flighted out of Temple or you could be transported to Beebe where you can wait for potentially a Temple bed. Okay, I cannot help but take this opportunity to give you another commercial. Did you know that if you're a transplant patient, especially now for liver and kidney, right, you don't have to go to Philadelphia anymore. If you want, we now have a partnership with Jefferson where twice a month, I'm sorry. We'd like to make it twice a week. And we started it up when? Last 2 months ago?
Yeah, it's in July.
We have Jefferson transplant doctors in liver and kidney coming down to Milton. And they do all the work. So what you do is you go see your primary care doctor or your nephrologist or your urologist or your hepatologist, your gastroenterologist, and you get treated. But when it's time to, I think you might need to look at getting a transplant of some sort. You don't have to go to Jefferson or Philadelphia or Johns Hopkins. You can go to Milton. One of those doctors there comes down to see you. And when they say, yeah, you need a transplant, they'll put you on the transplant list. They'll do all the labs and all this stuff, work up at Milton on that Milton Ellendale Highway Clinic right next to Kemp's, across the street from Kemp's Liquor. And then when it's your turn to get a transplant, you get called. Now, we don't do transplants at Beebe. You would not want Beebe Healthcare to do a transplant on you, right? You want to go someplace where like, how many of these do you do? Oh, we do about 5. 5 what? 5 every 2 years, right? Versus you go to Temple or Jefferson or Penn, 5 a day, And what happens is after you do the transplant, you come back down to your home and then your follow-up care is through the Jefferson Clinic in Milton. You don't have to go to Philadelphia unless there's a complication that they say, yeah, you need to go up there and be admitted to the transplant unit. That's the kind, I don't use that as a commercial, but I use it as an example of what we're trying to do to build a community health system that is integrated to keep patients, Delaware patients, in Delaware instead of sending them to Philadelphia or New Jersey, unless they have to go because we don't have the capacity to do that. But that's the question, that's the answer about Temple. Okay, Ryan?
We have this young lady, the gentleman in the Callaway hat, and go to you. Just wanted to say really quickly about Epic. We're really sending a lot of communication updates on my chart, so there'll be information coming out in the fall. That'll help you guys get signed up.
See, by the way, what he's saying is this, that once we build this, working with you, we're not gonna be like, yeah, see you later. I'll be over there in Lewis if you need me. Okay, Jamie knows this. We're on speed dial together. He calls me up when there's a problem. Mayor McKee emailed me a couple times already from his Europe vacation. We are going to be your health system. That is not a tagline. That's not marketing bullshit. That is exactly what we do. And for those of you who are in the service, you know, that is how we take care of people that we served with a long time ago. Okay, so when Epic comes online, you'll be brought in, whether it's at the Dagsboro Fire Hall or the fire hall here or this place, where we actually will have people who will say, you can actually put the app on your phone. We'll help you do it. We'll help you connect. Now, whether you're a Beebe patient or a Tidal patient or a Bay Health patient, okay? Because that's just the power of the technology that we can to help you with your healthcare. Yes, ma'am. I'm sorry, what was your first name? Nicole.
And what about resurrecting or establishing community care medicine, given the kind of diabetes and the support failure? It was a success in 2019. I would love to see it come back. And then thirdly, all of these ideas are some short-term, long-term. They're building this new facility. Now that all of Sussex County is considered rural by federal definition, there is opportunity for rural emergency hospital conversion later on down the line. Once we have a population opportunities and shifts, and the world health transformation of the nation. And then I can see your coming first. I think the guidance is coming out pretty soon. So a lot of these ideas I think will fit very nicely in a plan that to be developed.
Can you repeat? And what was your name again, Nicole? So Nicole reminds me of some days when I come home and Rebecca, my wife, says, okay, I got a little honeydew list. And I'd forget it all, but what she does now is she actually texts it to me. And then I get to put it on and get the check off ones and, you know, so I'm going to encapsulate what Nicole has said, hopefully in something that we can summarize, which is this, that Millsboro is technically still rural healthcare. Sussex County is technically still rural healthcare. And as a result of the changes in the legislation and the bill and the law that has passed, there is conversation about whether rural healthcare systems can get something called funding from the Rural Healthcare Transformation Fund. Okay, I know it's 50 billion, sounds like a lot, but if you think about the entire United States and all the other rural health systems, you know, we're going to be like, I don't want to, you guys will know it, like hogs at the trough beating each other away. So the answer is yes, we are working very hard. We are, even because people think Beebe is like, yeah, you guys aren't rural. You guys are like resort. No, we're part of a rural health system. One of the reasons why we're here is to make sure that people know that, other than the fact that we provide a service for you. So I have been actually meeting with everybody from Senator Coons, Senator Blunt Rochester. I met yesterday, was it yesterday or day before yesterday?
Yeah.
With Senator, no, with Congresswoman McBride. That was Tuesday, right? In Milton. And you know why I did Milton? Not because she was in Milford, but because when you're on the second floor of Milton, once again at that clinic, it's like, look where we are. We're surrounded by cornfields. If you have any doubt that we're a rural healthcare system, just go look outside. She's like, yeah, okay, got it. We're working very hard with them. And then, of course, at the state level, and you might hear about it later, about how the state then has to identify who should get the rural healthcare transformation money, how to distribute it. Okay. I mean, okay. I hate to say, I shouldn't have used the term hogs at the trough, because this is one where we're gonna have to fight. Other health systems actually are headquartered someplace else. I don't know if you know that. And those health systems actually are in locations that are metropolitan and not rural. Right? I didn't know that, but that others, the other state and city is actually considered metropolitan. Okay, I guess it's because they have an airport and a college. I don't know. You know what's going on at Christiana up north? Where they're now, I don't know if you heard, but they're in merger agreements now or discussions with places in New Jersey. Beebe Healthcare, I'm not embarrassed to say it, but Beebe Healthcare is the only local, nonprofit, independent, community, rural health system. So all the questions that you asked about, are we going to apply for these funds or those funds? The answer is absolutely yes, right? And we will be working with the EMS services to talk about how we, in fact, somebody mentioned to Mayor McKee whether or not we should have a police substation there. I can't believe it hasn't come up yet. How would you feel about that? Sorry, I should have. He's got a weapon, so I gotta make sure to be over here. But you know, that's what I'm talking about, okay? Yes, sir.
Police on the phone call in the power station. And I was the operation manager for Sussex County. And this came up years ago about when Bayside down when the board developed, and they had a plot of ground there. And it was plenty. The guy in charge, or who owned it, Freeman, he was going to give us the property, and he was going to do all the preliminary stuff for the building. And state wouldn't approve it. So I'm telling you, when they get a budget, unless you're talking 5, 10, 15 years out, that ain't gonna happen.
Well, with respect, that's state trooper. You guys are a city municipality, right?
Well, in Sussex County, we cover the whole county.
Oh, I know, but I'm talking about this plot of land. This is city land. So I'm not saying we should do it, but like I said, this is one of those areas where it's important for us to consider the community's will and interest. Because I can make an argument that having some form, you know, when I was in Santa Monica, California, we actually had a police substation at our hospital. For two reasons. One, because having the police car there and didn't mean that the police officer was there every single day. Made sure that some of the people that like to cause trouble thought twice about coming into our ER and causing trouble. Right? Now, I don't know if that's the same situation here. But you're right, we are in a different place. I'm not saying we should do it. I'm not saying we could do it. Oh, no, I'm saying we could do it. If there is an interest, because at the end of the day, I would consider security for not just you all, but our staff as well and the patients, a component of wellness, which is what this campus is all about. Okay? How we doing, right?
Sir, in the Calvin, do you have a follow-up question I have while you're hand?
It might have been long enough he forgot. That's what I do all the time.
My chart, I already have my chart at town with Jersey.
Yep.
Audiologist in Brookfield. Would that be?
Yes, it'll be integrated.
Right now I got a side of paper to transfer records over.
Yeah, it'll be integrated. And to me, I'll tell you the other reason why I love my chart. How many of you have kids who live out of the state? Right? Well, and how many of you have kids that are actually still in the state? Good. But you know, my mom lives in Orange County, California with my sister, right? She's healthy, thank goodness. She's 93 now. And here's what happens when she goes to the doctor at Hoag Health System in Orange County, California. She calls me up. She goes, Akira, which is my Japanese name. And this is all in Japanese, which I only speak 3rd grade Japanese. Right? Which means you use like different words, if you know what I mean. And she goes, I went to the doctor and he told me this and this and this and this and this and this. What do you think? Hold on, Mom. My chart, Hoag Health, the authorization code that she has given me. I get to see everything that happened in that office appointment that afternoon. I get to see all the labs her doctor saw. I get to see the chest x-ray that she had taken. What an opportunity for us in this community with so many retirees and kids living out of state to be able to connect families together so that they can understand what's going on with their mom or their dad, and they don't have to rush over here from Atlanta or Baltimore or New Jersey or whatever, right? That's the power of what we're doing here. And once again, it is something that we are investing in. We got the Cadillac version of Epic so that we can make sure that that kind of service is available. But that's exactly right. The docs at Temple will be able to see exactly what happens at the clinic, what happened in the ER, and we'll see our labs, see what happened, see the notes, right? And help make determination, and vice versa. The people at the ER here will see what happened at Temple and what you're covered for and what meds you're on, because the last thing you have is, yeah, here's my list of all my meds, right? I don't think I can remember my list, and I'm a doctor. But you see what I mean? That's the power. Yes, sir.
Two parts. Gary from Plantation Lakes.
Hi, Gary.
Everybody else. Are you consolidating all your offices here in Millsboro into this one building? And can you set up a trailer with the pharmacy like next week? Skip the
I'll take your second question first, which is no, not next week. But we are trying to go fast, right? Because even if it is a trailer, and you can imagine the problem with a pharmacy trailer.
Please don't.
Okay, we're gonna need armed guards for that. You have to have a police presence there. But it's not a bad joke, because believe me,
Lost the big one.
even though I am, what am I? I'm the CEO of the health system. Somehow, and I take that responsibility freely, although sometimes my staff is like, oh my God. People ask me about pharmacy. People ask me about dental care. It's like, I don't have a dental care. I don't have a dentist, right? People ask me about, veterinary care all the time. And it is something that we know that pharmacy is a huge problem. You go see a doctor, you go home, and then I think I better go to Rite Aid and pick it up, or not Rite Aid anymore, sorry. Go to Walgreens and they're closed. How do I get my medicine? They're closed till tomorrow morning. I can't go tomorrow morning. That's why we have bought our own pharmacy. So we'd like to get it done as soon as possible. And you have heard that it is part of this building.
Yes. It's awesome.
Okay.
Consolidation.
The answer to that question is maybe. And here's the reason why. I think we talked earlier, I don't know if you were in the room, the consolidation of things helps us do a better job of being more efficient, right? You don't have to have one office here with a nurse, a certified medical assistant, a front desk, right? A phone operator, and then you have another one over here with another doctor, another nurse. Well, put them together, and those two doctors don't necessarily need all that staff. It's not because we're cheap, although, yeah, got to save money, but also because you and I have just talked about how difficult it is to recruit those support staff to a place that housing, school, and everything else is, is really challenging. Okay, and I know that these guys are working really hard on that, and it's another situation. Someone asked me, "Are you going to build housing?" Well, I don't know. It depends kind of on what the needs are and how to provide wellness and healthiness for the community. And then we'll work with people like Jamie and the council to figure that out. Right? So I don't know if we're going to, because those are assets, right? Maybe we sell them. Maybe we don't. Maybe we keep them and then continue to grow in other ways. I mean, we cannot do what other places do, is just build something when there's something just down the street that's not used and half empty anyway. Okay, I hope I wasn't being too pointed on that one. But you know what I mean? We have to be very efficient about everything that we do because we are a family business. So that's the answer to your question. I don't have an answer. To some extent, it will depend on what we're talking about today. What are we gonna build here? Because if there's no room for other stuff, then maybe we do need to do that, right? Or maybe there is an opportunity for it to become, even though it's not necessarily right here, the population health office, community health office for this part, the western part of Sussex County. Yes, yes, sir.
If we could just, sorry, there's just a few people queuing.
Oh, okay.
And if we could go a little rapid fire, because we're getting a little short on time.
He's telling me, he does this all the time. He says, just shut up.
The young lady who in the back, she had a question, and then we'll come to this gentleman, right?
Erin from Hancock, how are you?
I'm sorry?
I'm Erin, Hancock.
Hi.
I just want to speak, two quick questions. How many jobs are you providing on the stage one with this new building? I know there's a lot. And then I want to see if you give me a kind of a breakdown of doctors, emergency for cardiologists. Do you have a plan for how many pediatricians at the get-go, how many PCPs, how many neurologists?
No,
Okay.
I mean, no, and not, no, I can't tell you. I don't have a deliberate plan yet because we don't know the size, we don't know the scope, right? And we continue to build, but we can tell you those are the key clinical services that we want to have here. And that's important because PAM Rehab, I assume, will need neurologists and cardiologists to work in their facilities, right? But I don't know, who's your partner? Oh, yeah. Okay, next.
Yeah, I was just wondering, after you get all the approvals, what's your baseline schedule?
Paul, you got one?
So everything in place, meaning
Yeah, open the door. That's
open the door,
right.
24 months. Just, it's a lot of work to do in a short amount of time, but I can tell you that we are actually phasing this project. So you will actually, little cat out of the bag, it saves us a bunch of money if we do it ourselves. So we're gonna prime all the site work. So basically, within the next, I'm not gonna say when, as soon as we have our approvals soon, well, we don't have access to the site. So once we can get access to the site, it'll drive our schedule. We're actually gonna jump on the site work and actually prep this entire site. So the pond will be dug, this will all be prepped and ready to go. So that we're ready to pull the trigger for the building. It can go.
2027. Aaron, right?
Yeah.
I apologize. Because I was being a little facetious and being sarcastic. That's my fault. I'm sorry. What I'm trying to say is, you know, there are things where we work with different partners. You know, I talked about Jefferson being, and that's not because we're in competition with Penn or Johns Hopkins. It's because we've identified things that work together and things that they need and things that we need. So I will tell you this, if George and everybody else at PAM needs our services and needs our medical directorships, they know that we've been in conversation with them. Happy to help, because at the end of the day, it's about serving the community. And I'm sure there are people from Millsboro and Georgetown who use PAM Rehab there.
My job is to be outreach, where our primary care is.
Yep.
Various certain care, so we refer to that.
So,
We're happy to have the services, so thank you.
so by the way, you saw something that seldom happens, is David Tam apologizing in public. Just someone tell my wife, okay? Okay, all right.
Right here.
Yes, ma'am.
She's rates. And I'm glad that I used my shorthand because I would have forgotten my question or my comments. But you did touch on how many people are going to have jobs and how important it is to support those people with living arrangements. Having moved from Bucks County to another nonprofit hospital there, on their campus, they have childcare. So when you were talking about what to put in that other space, a lot of your new employees, I know, are gonna have a hard time to get childcare. I think that's one thing that could be addressed. Another thing was, I was lucky enough to be a liaison, tell me the big word. Thank you. For the community when a high school was being built. And what I was able to do is to get concerns and questions to bring to those meetings. And I know our HOA sends out questionnaires. And if they could do something like that, maybe to our community, especially to the people most affected, then when they have a meeting with your people, that kind of, brings a little bit more cohesion to it.
Absolutely. So did everybody hear those questions? Yeah. So let's do childcare first. That's not out of the scope. But I'll tell you, at Beebe, because we are now spread out across the county. Instead of building a brick and mortar central location for childcare for our employees, we have been actually able to have a service for all employees where they can enroll and then they can actually identify from a list. They can say, I live in Millsboro, I live in Millville, I have a 5-year-old, I need healthcare during these hours, childcare in these hours, right? My child may have a special need. And the service then, it's like a, I don't know, I don't want, I don't want to, I was gonna say Tinder, so Match is better, right? Will allow you to select, will allow our employees to select somebody that is certified by this national agency and then certified by Beebe. And then they get to interview that person and then they get to choose whether they want that person to be their childcare provider. That's what we offer to all our employees.
One-on-one.
That is correct, because part of our challenge is everybody's working at 12 to 12, 7 to 7. Some people work on weekends, some people work nights. We are looking at a brick and mortar facility, and that would be something that I know that the mayor has actually sent to me, said, you know, and is that something that if you build one, that even citizens can be, can utilize? You know, people who live in Plantation Lakes. So that's another one. And another one, just to let you know, is that there's been a question about whether or not we should have senior care and adult daycare. And as you heard, we're building out more neurosciences. We have about 5 neurologists. 4 of them are brand new, coming to the area with dementia expertise and other kinds of things like movement disorders, something I've been really excited about as a pediatric neurologist. And that will allow us to be potentially medical directors of a daycare program, like a, you know, you'd have to probably sign up but yeah, I'm going to go to, what is that place? BJ's,
34.
right? And I really need to drop off my husband or my wife in a, you know, qualified, safe, certified place for 3 hours while I go do that or have a cup of coffee or play mahjong or whatever. So those are the things that would be part of that conversation as well. You need to help me open up your list, because when you're near there is a value of being near an ER, right? Because if something happens to your spouse, he falls, not to anybody's fault, you'd want to make sure that there's an opportunity to have them seen at the ER or the walk-in. So I think that was the first question. The second question was about yes. So that's one of the areas where we will be working with Jamie and the HOA to start developing this dialogue. I'm going to give you one caveat, and please understand. Did you just hear Dr. Magliano? Paul, I'm going to make him an honorary doctor, say 2027. I did. But that's with an understanding that if we make substantial changes to the site and figuring out what goes there, that could drag on for decades. So I hope you know that as we do this, to be mindful of our commitment to get something there, we might have to tell you, that's a great idea. I don't know how to do that. And we can't stop all engines and figure it out while we're moving forward. Is that a deal? Right? So thank you very much. Online. Wow, we got one on. Is this the first question online that you've gotten?
Yep.
All right. Thank you, Mr. City Manager.
So Melissa online says you touched on it a little bit, but are there any plans for a pharmacy? Believe it, because as you might know, pharmacies in Millsboro and the surrounding area are a mess.
So you know how Ryan just said, be quick? What's that? Who's that? Who's that?
Melissa.
Melissa. The answer is yes. I see. I see. We should get an audiologist too. Okay. We got 10 minutes. So what else do you have? Yes, sir.
When you talk about community service and community type issue, you have children's health and just health information sessions available for the public, especially based on the current national national health dialogue that's going on. There's not a lot of information going out to people.
Yeah.
About issues.
So I think you heard that I'm a pediatric neurologist, right? So pediatrics is really important to me. Neurology is really important to me. So it's one of the areas where we started even 5 years ago. Diane's engaged in all of it as the strategic partner. She's chief strategy officer, so she's the one that helps me make the deals and the connections with Jefferson. But Nemours is a big partner now, especially as you may have heard about the recent changes that Nemours and Christiana and Chopped have been engaged in. They recognize that, like Beebe, we need to keep not just adults, but kids and their care when appropriate in Delaware, close to home. So that is an area. That's why, I don't know if you know this, but if you go to Lewis, to our hospital there, we actually have Nemours pediatricians, pediatric intensivists, neonatologists, all already there on site, on staff. Because we recognize they're not just like little adults, they're completely different, right? And so the other piece about the community piece, the health and education piece, I'll leave that up to you to think about who's doing that here in Sussex County more than anybody else. And if we had a place to do that on a regular basis, yeah. Can you imagine if you're at Plantation Lakes and we were right there and we could have more community health fairs there without bringing everybody on site? That's the goal. Thank you. Anybody else? Because if there's 10 minutes left, I will use 5 minutes of it to close it up. You ready? So you guys know that I'm a doctor, then became an administrator primarily because every time I was a doctor and I wanted to do something for a patient, I got told no. Because, some suit said, you can't do that. It's not a policy, it's not a covered benefit, it's the wrong kind of contract or whatever. So I ended up becoming an administrator so I could help figure out how better to take care of patients. That's my journey of becoming an administrator. That's where we are today. If you heard what we said, we managed to work together with regulatory agencies, the town, other partners to figure out how to make something work and how to do something that is at the end of the day, the right thing to do for the community and the patients. I am competitive, but I'm not competitive because I'm out to beat everybody. I'm competitive because in my opinion, that is the right way to run a local, nonprofit, independent community health system. Somebody was talking about coming from up north, Pennsylvania. Who was that? Maybe they're gone, right? You saw what happened at Crozier. Crozier is an amazing place. I remember 20 years ago looking at Crozier going, wow, they're taking care of people. They're taking care of the people who need it the most up there, right in Bucks County, right? And now Chester County. Delaware County, right? I still get mixed up that the Delaware Valley is in Pennsylvania, but that's okay. My wife is from Allentown, so I'm learning about it. Lehighville. But, I want you to know, and this is not me being a Baptist preacher, that is why I came from California to do this job. Because there are things that we can do better for this growing population. And whether you're here as a 5-year guy like me, or a 20-year guy, or someone who, born 100 years ago from a family that not born 100 years ago, but you know what I mean, from a family, from one of the Townsends or whatever, it is our responsibility to take care of you as best as we can. So that's why we remain a local, nonprofit, independent community health system so that we don't end up like Crozier, where somebody else ends up buying us off, owning us, telling us what to do. It may sound arrogant, but that is, in my opinion, the best way for us to provide healthcare for the community that we serve. Why am I telling you this? It's not the Dave Tam story, okay? But you heard it today about why we want to engage you. And the last part is, to be very honest, running a local nonprofit independent community health system. I've learned it's a hard lesson. As a doctor, you don't learn to do this. But I need your help. I need your help by giving us input on what you want. I need your help. And that's why I took some time to explain. It would be nice if we could also build things that generate revenue. Childcare could generate revenue, right? Retail stores could generate revenue, a casino could generate, no, don't worry. Don't worry. But you see what I mean? That is what we do to make sure that we run a family business and how we make sure that we are paying for the things we buy for the family. And that's why I wanted to be upfront with you. You don't see other CEOs coming up and talking about it with you and asking for your help. Because we do need your help to understand that if we say, no, I'd love to do that, but I can't, it does involve money. It does involve how to make sure we generate the revenue necessary, especially when you see what's going on in the news with Medicare and Medicaid. And it, once again, I learned in the Navy, politics aside, the reality is the reality. Okay? So, as you go out of here, once again, make sure you get more information. We'll have more town hall sessions. The other thing I need you to know is that now that we are going to be part of your community more, please know that we would ask you to be part of our community. Steve Tyson is from the foundation. That's the people that do a better job of asking for money. I'm the setup guy. Okay? You've heard why we're doing this. I hate being the guy with the hat out. But this is what it takes to be a local independent community health system and not have someone else from another county or another state buy us or take control of us. Because we know best, I think, how to take care of you and our community. Right? When I see the Millsboro ambulances drive by every day, when I'm sitting in my office on Savannah Road, I know how hard these guys work. And sometimes I go to the ER and I say, how you doing? How was the ride? Right? And the same thing, by the way, for the people in Dagsboro, Ellendale. Okay, what's the place west of Ellendale? Something Wood? Greenwood. They're coming from Greenwood. The last thing about that is I asked somebody, why are you coming from Greenwood? Right? The answer was because the patient asked to be brought to Beebe. You will hear our mission, or actually our vision, as Dr. Hall has shared with me, is to be the health system of choice for the people of Sussex County. I know that that's impossible because we can't take care of everybody. But we want to make sure that you know that there's a health system that you can think about and say, yeah, I'd like to go there if I could. I'd like to get an appointment if I could. I'd like to go to the ER there if I could. Okay? So help us. And there's literature out there. We need your financial support. If you want to donate $10, that's fine with me. If there's a club called the 1916 Club, because 1916 was the year when Doctors James and Richard Beebe left here, went up to Philadelphia, went to medical school, came back, opened up a hospital in Lewis. That's that white building, right? Built in 1921. So 1916 was when Beebe Healthcare started. I need your help to keep it going and not have it absorbed by somebody else. You and I know that that's happened here in a variety of places, north of us and south of us. Okay, but if you like what you see here, if you like the fact that we came to talk to you, please ask Stephen for some of the paperwork and ask him about any questions that you have. I'm not embarrassed. Okay, it's what we do. Thank you so much for your time. And this will not be the last. I will reach out to the HOA through Jamie to talk about how we can coordinate something, even if it's at the clubhouse at the Plantation Lakes Golf Course, right? And do the things that you talked about is how do we work through the HOA to get out some kind of questionnaire? Those are all great ideas. And if you have any other information or any other thoughts that you have, you can reach out to the mayor or you can reach out to the other members of the council or Jamie, because we have a direct line where they tell us what they think we should have here at Millsboro. Thank you very much for your time. Thank you for paying attention. And I look forward to seeing you soon.
And that turned